Hi everybody, it's Dominic from Shift.ms. A lot of you guys that watch these videos, we know are from the US. And today we have another US doctor who's made the effort on a Saturday to get out of bed and come and talk to us. And we're really grateful to Dr. Brandon Beaber in LA. So I will pass the baton to him to introduce yourself, Brandon. Tell us a bit about yourself.
So thank you, Dominic, for having me on. I am, in fact, a US-based neurologist, primarily working on treating people with multiple sclerosis. And I have some interest in engaging with people who have multiple sclerosis online. And I have a YouTube channel where I make informative videos about MS, and I'm active on Twitter. And I'm very interested in new research and just interacting with people in the community, not just other MS doctors and researchers, but also just people who have MS and seeing their perspective.
Just wondering, how's the US healthcare system responding to this pandemic?
Well, it's the wild, wild west out here. We have a lot of different competing companies, so no one is doing the exact same thing. But primarily, we're fighting this with 20th century technology, even 19th century technology. The main thing we can really do is social distancing. And where I am, which is in Los Angeles, California, on the west coast of the United States, it really has been a profound change in lifestyle. Essential businesses are all closed. Schools have been closed for a long time. People are wearing masks in social gatherings. Anyone who can work remotely is working remotely. People are wiping down their groceries after they buy them using delivery services. Despite all of our technology, all of the testing, all of the potential antiviral medications, the number one thing we can really do is just stay away from other humans. And it does seem to be working. That's the good news.
But how does it work in the US? If you've got MS and you need to talk to medical professionals or see them, what do you do?
Well, in my organization, you can call, you can email, you can make an appointment, although we're trying not to have people in unless you absolutely need to. At the beginning of this, I had a tremendous number of people reaching out to me asking what to do with your medication. And so that's probably the number one question a lot of people had early on. And certainly, I think you should talk to your neurologist or your provider about that. Obviously, if you have symptoms of COVID-19 and you're concerned about that, usually what's recommended is to try and call your primary care doctor or call the helpline and get some advice. And obviously, some people, if they have shortness of breath, they're being advised to go to the hospital. Some people who have mild upper respiratory tract type symptoms are just being advised to stay home and take time off work and self-isolate. We have a drive-by testing system. So some people were saying, don't come into the hospital. We want to see you, but you can drive by, we'll swab you, and then we'll tell you whether you have it or not and self-isolate until then. So far, we've been okay because even though we have more COVID-19 patients, we have a lot less of other things like elective surgeries and maybe relatively minor illnesses that don't have to be treated in emergency facilities. So we've done okay so far.
What's the impact of I suppose healthcare inequality on the outcomes for people, because it's an insurance-based system in the US? Is that having any impact on MSers? The virus, the insurance or lack of? I don't really know how to ask you the question, Brandon.
Well, obviously in the UK, virtually everyone has access to healthcare. In the United States, it's a little bit more complicated. Historically, there was a time in the United States when about 50 million Americans were uninsured out of about 330 million Americans, so a pretty high number. And there's a policy in the United States called the Affordable Care Act that allows, a lot of people to get sort of discounted or even free health care if they have low income, for instance. And that's decreased the number of people who are uninsured by a significant amount. But there's still quite a few people who are uninsured or who have relatively poor insurance coverage that sort of limits the options that they may have. And so there are certain inequalities out there. For COVID-19 in particular, that may interfere with your access to testing, potentially your access to treatment, although of course anyone can go to the emergency room. One thing that's been highly criticized in the United States is that testing is very difficult for some people. The criteria have been strict, although it's a little bit more available now. Unless you needed to be hospitalized or unless you actually had contacts with people with COVID-19, a lot of people didn't recommend testing. They just said, stay home and self-quarantine if you're mildly ill. Another thing is just sort of health knowledge. Some people have jobs where they're able to self-quarantine. If you're a software developer, you can stay at home and program from home. Whereas if you work in a busy factory, you're at much greater risk of developing COVID-19. In Los Angeles, we have a very large homeless population, and we have an area known as Skid Row where there are just a tremendous number of people, thousands, tens of thousands of people who are homeless living in close quarters. And we were very concerned about them getting COVID-19 and spreading it to each other rapidly and becoming ill and having a lot of deaths and overwhelming the healthcare system. So there have been a lot of efforts to put homeless people in temporary housing to try to prevent the spread of the illness there. People have actually studied certain racial disparities. It turns out that African Americans in the United States have a little bit of a higher risk of dying from COVID-19 if they get it. And part of the reason may be that they sort of have worse health overall. They tend to have a little bit of a higher rate of certain comorbidities such as heart failure and diabetes and hypertension, and that may be contributing to the worse outcome, along with other factors like socioeconomic factors.
The first thing that I'm almost obliged to say now is the US data repository at iConquerMS.org, where people can sign up, where MS patients can sign up, just like they can in the UK.
There are a lot of unanswered questions. We did get a little bit of data from Italy and France that Professor Gavin Giovannone posted on his blog. And it seems that preliminarily, people with MS don't seem to be more likely to get COVID-19 or have a bad outcome of COVID-19. In Italy, they did report that there were 5 people who died of COVID-19. All of them had progressive MS and a significant amount of disability prior to getting the illness. 3 out of 5 weren't taking any disease-modifying therapy whatsoever. But I did the calculation on the number of deaths and cases you would expect, and it does not seem that, at least preliminarily, people with MS have a higher risk. But we would like to get better data, on certain disease-modifying therapies. Are they more dangerous? What should we be advising our patients to do? Because there really could be a second wave in the Northern Hemisphere in the coming fall and winter.
You talk to us a bit more about the more US-based or global-based research that's being planned with all this data. What does it look like going forward to learn more to protect people with MS?
Well, like you said, one of the main things is those vaccine trials. Obviously, we cannot blindly give a vaccine to 300 million people in the United States without testing it and making sure it's effective and safe. But if we could somehow complete that before next fall, that would be amazing. It could save a lot of lives. Another thing is we'd like to have a little bit more research on treatment of COVID-19. There are many possible agents that could be effective. Hydroxychloroquine, remdesivir, ritonavir, lopinavir, various other antiviral agents. Luckily, we are going to get an answer. There's a worldwide study starting in Norway. It's an actual randomized trial for hydroxychloroquine and remdesivir. And so there's some preliminary data that looks somewhat promising, but I think we're going to get some hard data and we're going to know, are these treatments effective or not? And of course, we don't want to give ineffective treatments because they can cause side effects and complicate the situation. But if we could have an effective antiviral, maybe we could diagnose people early and treat them early, and they wouldn't go on to develop pneumonia, wouldn't go on to require a mechanical ventilator.
Where do we go from here? How do you see it changing for people with MS?
Well, unfortunately, one warning I would give is even though the trajectory is likely to be good in the short run, we're still pretty close to the peak. So you should be careful and follow your local social distancing guidelines. Talk to your provider about recommendations for your own treatment. There are many people I wouldn't recommend they just stop all treatments just because they're afraid of the second wave of COVID-19. It's certainly a discussion to have. Unfortunately, I do think it's highly likely we could have a return of cases in the fall and winter based on a concept called herd immunity. But, honestly, we can't be in fear forever. We have to return to life and just do our best. And maybe we'll be more prepared by then. We'll have easier testing, maybe even a known effective treatment, or using big data in order to rapidly diagnose and quarantine people to prevent the spread in a sort of more modern way.
Hey everybody, that was really cool of Brandon Beaber to join us. At the bottom, you can subscribe to our channel, you can subscribe to Brandon Beaber's channel, all the good stuff. Take care. Cheers. Bye-bye.